Welcome to the Health Matters podcast. This is Kareem Amiri, your host, and today I'm really excited to have Becky Brinker, Director of Operations, and Mary Weber, Customer Service Performance Champion. Today they're going to share some exciting stuff that we're doing in customer service around trying to take the member out of the middle and really improve their experience. So Becky, before, and Mary, thank you for joining me today. And before we jump in, do you want to take a moment to introduce yourselves and tell the audience about what you do at Wellmark?
Yeah, sounds good. I will start. My name is Becky Brinker. As you mentioned, I'm a Director of Operations here at Wellmark. I've been here for about 2 years. My experience has been over the last couple decades supporting customer service, and wow, that makes me feel a little old saying a couple decades there, but supporting customer service. I started as a frontline representative in my career several years ago, worked my way into different roles, and found myself here at Wellmark. Like I said, a couple years ago supporting customer service, and so that passion for providing our members services, and we'll get into more of that after Mary does her introductions, but very excited to be here, so thank you for having us.
Yeah, glad to have you here. And before you jump in, or I'm going to jump in before you say something here, I started my career in customer service a little bit more than 2 decades ago. Okay. I don't want to really say exactly how long ago, but it was a great place to work, and enjoyed my time in customer service. This is close to my heart to talk about.
Good.
This. Yeah. Mary.
I am Mary Weber. I'm a customer service performance champion. My experience with Wellmark really started before I came to Wellmark from the provider office. I worked in insurance and collections, loved the work, loved the folks that I worked with at Wellmark, and it really was the driving factor for me coming here. It was 26 years ago next month that I came to Wellmark, and I had always said, if I leave this position, it's going to be to go to Wellmark. Just the experience that I had in working with their staff, the passion that they had, and seeing how well Wellmark did things was really the driving force in me coming here. I love the customer service work. All of my 26 years have been in customer service, very passionate about what can we do, and looking forward to sharing some more information.
Yeah, I love that you shared that. I know personally, like the teams that I work with and support, they always love working with you, and I'm sure at the same time our employers and their members love working with you as well.
Thank you.
Yeah. So I know we were talking about how we can help the member and really take them out of the middle or some work that they may have after a call, and I think we've come to call it internally no homework for the member. But if you want to talk about the approach and how you engage members and how we achieve this goal that we want to provide to them on really taking them out of the middle.
You never know what someone on the other end of the phone is going through. And so really, what can we do to help be great partners with them on this complex role, right? So many times it can be challenging for us, for providers, for our employer groups. We really want this focus to be, how do we help embrace that piece? How do we take our members out of the middle, out of that mess, so that they can focus on their health and well-being, right? We actually started the Taking the Member Out of the Middle enhanced focus at the end of March with our national and preferred account teams. We've continued to roll that out and hoping to have that with a large portion of our members by the end of June, and then hopefully wrap up the rest of customer service by the end of July. So really
Fantastic.
It's so exciting work, and I am so passionate around it. It makes me smile from ear to ear every time I think about it.
And I'll see it.
Sorry. But I just think that we have this great opportunity that's bigger than a health insurance claim, that's bigger than a benefit, that is, what do we do to embrace and help people on this journey? We are not here to tell a provider how to bill a claim. We are not here to say, you should have, or this is the right way to do it. We can certainly help and partner with them, because we want to make sure that our providers are getting paid for the services that are appropriate services. We want to make sure that people's health health and well-being. It's not in our best interest for them not to have services they need to have done. So how can we help them on that journey without telling a provider how to bill it? So that's one of the things we wouldn't do, is tell them how to bill that. And then just some of what we're doing by taking that member out of the middle is maybe making an outreach call to a provider office, providing insurance information. We've had a couple recent examples where we needed to have newborns, babies, claims filed to us. So members were getting billed, but we hadn't received the claims. So we were able to call those providers and have the claims submitted. Those are huge wins, and it gives us the opportunity to take care of it and to say, hey, I talked to Jane at your provider's office, and they're going to submit that claim to us. And then, the member, it gives them peace. And you can really hear in their voices the appreciation that they have.
I'm sure HR teams at our employers would be appreciative as well, because I'm sure they get those questions too if it's not, handled and done for the member at that time. So, yeah, I'm sure they thank you as well.
Thank you. Thank you. We love it.
And just to add to, we do not take that responsibility lightly. We know that these things are complex, whether it's calling for something as simple as an ID card or calling with a new diagnosis that somebody is having trouble walking through the processes. We really want to take those steps to help. Insurance benefits can be very complex, and we want to take, like Mary said, we want to really take them out of the middle and see what we can do and genuinely care for those individuals that are calling, your employees that are calling. There's all walks of life, that whether they just turned 26 and they're no longer on their parents' policy, right? Or this is
I'm
the
approaching
first.
that with some of my one of my kids.
I thought you were going to say you're almost 26.
I wish.
But yeah, yes. And so with your kids, this will be something new. They had dad take care of it, right? And now they have to do that on their own. So what questions do they have throughout that journey?
Great. I mean, great overview. I think a question that comes to my mind is, as a member's on that call, let's say prior to March to now, what looks different? What is the feel for the member as they're now in this new approach from Wellmark?
That's a great question. It really is about not saying to a member, this is what you need to do, but more so, this is what I'd be happy to do. And taking them out of that space. It's a difference between a member calling a provider's office and trying to figure out how to navigate the words, the pieces, the data, and our CXAs, those representatives of Wellmark as a whole in our business and how we take care of people calling that provider's office and taking care of it, letting the member know, I talked to that provider. So we're hoping that the members aren't necessarily getting all the specific, A to Z pieces, more so this is what I'll do, this is what I'd be happy to do, I'll take care of it, and I'll give you a call back on Wednesday with the outcome of that conversation. So really, less is more for our members and just handling it.
I love how you phrase that as this is what you have to do to this is what I'll do for you, or this is what I can do. I love that. I know you said that this only, the pilot started in March, really starting to expand it out to the rest of the population over time, or hopefully by the end of July. But do we have any statistics or any outcomes that we can share, success stories that can be shared?
Yes, we've seen so many success stories. One of the ways that we measure information is we have after-call surveys, and there are 4 questions that are asked in that after-call survey, and we have seen all 4 of those metrics increase in positive ways since we started the pilot. We're also engaging our staff. We want them to feel empowered. We want them to be connected to our members and the work they're doing, and so we're also surveying our CXAs to get their input, and really wanting to be, again, partners with everybody, the CXAs, our members, our providers, our groups, and just come together, all of us collectively, again, to what can we do. And so we've seen all those numbers increase. We're seeing increases in the number of folks that are responding to the surveys afterwards. I believe we saw an increase of 46% in those after-call surveys.
Because I never respond to those?
Huge, right? And so we've helped educate our staff on best practices to get that member to the survey, and then we as an organization are really leaning into what is the information we're getting back, right? Not just another survey, but then what are we doing with that data that's been provided? So exciting stuff.
What do you think the benefit is for employers? We've mentioned a few already, but is there anything else that comes to your mind that how they could be recipients or this program is doing better for them?
Yeah, absolutely. So just part of the overall structure is when we think of our contact center and we think of our strategy, we really want to move from a transactional-based contact center to a value-based contact center. And what does that mean? And Mary talked a lot about like how we're doing that with no homework or taking the member out of the middle. But when you ask the question, like how does it help the employer groups, is there's an expense, right, to offer insurance. Yeah. There's an administrative,
we have an all-inclusive administrative fee. How does this play into that?
We do, right? And what are we doing when we have your employee on the line with us, and are we spending the time adding the value to the conversation, not just answering the question, anticipating the next steps. What happens next? What happens when they get this claim, or when the claim is submitted and they get their EOB? What is next? And so really truly using that time that we're on the phone to add the most value. So we're very excited about being able to do that. And in turn, if you have happy employees, they're going to make sure that they provide that feedback.
Yeah, that's a big metric for employers, is that satisfaction in their health plan. And it's great to see where we're investing some of those administrative dollars into programs like this and increasing that member experience.
Yeah.
Awesome.
Yeah. And I think to add to that, Becky, one of the other things we saw from the surveys was one of the first questions is, were all your questions answered today? And we saw an increase from pre-pilot to post-pilot from 78 to 90%. And so part of the savings really is trying to take care of that one and done, really encompassing that experience so that you don't have repeat calls, so that you don't have that added frustration or additional inquiries going back to the employer group, to our agencies, to our producers with questions that we want to be able to help people through.
That's great to be able to hopefully get that resolved for the member on that first time.
Yeah, what's also nice about contacting Wellmark is you're going to get your call answered very quickly. So we answer our calls very, very timely. And so you're going to get to an advocate, a CXA that is really going to take the time to help. And we're really proud of that we can answer those questions. And so if we can spend a little bit more time on the phone, interacting, making the experience easier, we're in a position that we are happy to be able to do that. And our CXAs, the feedback that we're hearing on allowing them to do that, because that takes some additional time, takes some additional follow-up, calling the providers, calling a billing department. And they really, really like being able to have that opportunity to do that.
I'm sure it's empowering.
Yeah.
And an empowered employee is always better.
Yeah. Yes.
Well, Becky, Mary, thank you so much for joining me today. Before we sign off, is there any last things you want to say that we maybe didn't cover?
I just want to thank you for this opportunity. We are really your neighbors, right? We're your family. We understand. While we haven't been through every situation, we are within your community. We're here to help. And so, again, very proud of the work that we do in Iowa and South Dakota and beyond, right, for our national accounts. And so, again, we thank you for this opportunity to be able to talk about how proud we are of our team and what we're giving back to the employer groups, the members, as well as our community.
Yeah, I agree. And then just adding in, I absolutely love this work we're doing. It's easy to be smiling and passionate about things that just feel right. I think it's important to remember that the work is never done, right? It is constantly, how do we elevate? How do we make it better? What tools, what resources, what experience? And so I think it's so important to keep at the front of our minds, what else can we be doing? What are the places we haven't been that maybe we haven't thought about that we can lean into?
Well, I love the passion you both are sharing. And once again, thank you for joining me today. And thank you for tuning in today to the Health Matter podcast. And we hope you found the information helpful and insightful. And, please don't forget to subscribe to the Wellmark YouTube channel. And we'll see you next time.
Thank you.
Thank you.